Today, we are cracking the code on your body's own dashboard. We're talking about vital signs, those key numbers that tell a story about what's really going on inside you.
So, have you ever wondered how doctors and nurses really know what's happening inside your body? I mean, they can't just look at you and see how your arteries are doing, right? They need hard data, a direct line to your body's command center. And that's exactly where vital signs come in. You can literally think of them as your body's dashboard, showing these key indicators that give us essential, real-time info about your health. Honestly, they're the most fundamental clues we have to your well-being.
So here's what we're going to cover. First, we'll get to know the 5 key indicators. Then, we'll see why getting an accurate reading is so critical. After that, we'll decode what those numbers are actually telling us, and finally, see how it all comes together to create a complete picture of your health.
All right, let's dive right into our first section. Time to meet the 5 key players, the core measurements that are the foundation of pretty much any health checkup. Okay, first up is one we're all familiar with, temperature. But this is about so much more than just feeling warm or cold. It's a really precise measurement of your body's incredible ability to balance the heat it creates with the heat it loses. And just look at how narrow that normal range is. Your body is working incredibly hard, 24/7, just to stay within that tiny 1 degree Celsius window. It's a super delicate balance, but it's absolutely essential for keeping all your internal systems running just right. Okay, next up, let's talk about your pulse, or your heart rate. This is like a direct window into how your heart is doing, how well it's pumping and circulating blood all through your body. It's really not just about how fast it's beating. A good healthcare provider is also checking out the rhythm. Is it nice and steady, or is it irregular? And they're checking the strength too, which tells them a lot about the force of each and every heartbeat. And now for our third vital sign, your respiratory rate. Now, this might seem like just a simple count of breaths per minute, but it tells a surprisingly deep story about how well your body is taking in and using oxygen. And here's a little insider tip from the clinic. This is often measured, well, kind of sneakily, maybe while the nurse is still holding your wrist for your pulse. And why do they do that? Well, because the second you know someone is counting your breaths, you almost can't help but change how you're breathing.
All right, let's tackle the big one, blood pressure. Now, this one can seem a little complicated, but at its core, it's just a way to measure the force of your blood pushing against the walls of your arteries as it travels around.
So, you always get 2 numbers with blood pressure, right? That top number, the systolic, that's the pressure when your heart is actively beating. And the bottom number, the diastolic, that's the pressure when your heart is resting between beats. Putting them together gives this amazing snapshot of just how hard your heart is working. And finally, the last of our 5 key indicators, oxygen saturation. You probably know this one from that little glowing red clip they put on your fingertip. It's such a quick and easy way to check on a really critical function. So what is that number actually telling us? It's simply the percentage of hemoglobin, that's the protein in your red blood cells, that's currently carrying oxygen. For a healthy adult, we want to see that number as close to 100% as we can get. Okay, so now we know what we're measuring, but let's move on to how it's done, because getting an accurate reading is absolutely crucial. A wrong number can be just as misleading as having no number at all. To make sure they get it right, healthcare providers follow this really methodical process. First, they get you, the patient, ready, making sure you're rested and comfortable. Then they pick the right device, like a blood pressure cuff that's actually the right size for your arm. They follow a consistent order and use the correct technique for each measurement. And then, right away, they document what they've found. Every single step here really matters.
Okay, so what happens when the numbers don't fall into that neat little normal range? Let's decode some of the common medical terms you might hear. That way, you'll be in the know.
So, for your heart rate, if it's consistently ticking along at over 100 beats per minute while you're resting, that's called tachycardia. And if it's dipping below 60, that's known as bradycardia. Both of them can be important clues to what's going on.
And for blood pressure? Well, you've probably heard these terms before. Hypertension is just the clinical word for high blood pressure, which is a major health concern for a lot of people. And on the flip side, hypotension means your blood pressure is abnormally low.
Okay, this is so important to remember. None of these 5 numbers means anything on its own. A single weird reading isn't a diagnosis. Instead, you've got to think of them like pieces of a puzzle. It's only when you put them all together that you start to see the complete picture of your health.
A skilled pro doesn't just look at one number. They look for trends over time. They connect any changes to your symptoms and your medical history. They get that what's normal for, say, a marathon runner is going to look very different from what's normal for someone who works at a desk all day. It's all that context that turns simple data into real insight.
And this quote, this really gets to the heart of why vital signs are so incredibly important. This isn't just about routine checkups. Mastering these numbers is one of the most powerful tools we have for spotting problems early. It allows for quick action and ultimately leads to safer, more effective care for everyone.
So, the next time a nurse wraps that cuff around your arm or clips that little sensor on your finger, you'll have a much clearer idea of what your body is trying to tell you. You'll actually understand the language of your own health dashboard. And the real question is, what will you be listening for?